Hi everybody, my name is Pat Progar. I'm the Chief Clinical Officer here at Brett DiNovi Associates.
I'm Perrin. I'm the Vice President of International Clinical Services.
I'm Yostina Said, and I'm a registered behavior technician here at Brett DiNovi.
And what we're going to do today is talk about what happens if after you just pass the BCBA exam. If you like what you're watching, please subscribe. First recommendation that's come up is to celebrate your accomplishments.
Now that everyone taking the exam can go into the testing center and get that immediate reinforcement of I've passed, what should you do? You should celebrate. You should absolutely celebrate. You get that immediate feedback in terms of how you've done, and you should be celebrating, right? This is like a big accomplishment.
Absolutely. I will definitely be calling all my family members, FaceTiming my friends, and showing everybody once I do pass my exam as well.
Next recommendation is as soon as you find out that you passed the exam, and again, it doesn't have to be that night, but we always recommend, make sure you update your resume, update your LinkedIn profile. Again, kind of getting back to the question about, celebrating your accomplishments. I've often found like if you post something like that, even a promotion on LinkedIn, a lot of times you get a lot of people saying, hey, great job, or, maybe you get more connections, that type of thing. The other thing I guess that I sometimes run into, and the other one that I tend to forget sometimes too, is your signature page on your email.
Yeah.
So make sure you update that too.
If you're updating your LinkedIn, you can't not it automatically lets everybody know that you've updated it. So there's that, again, that immediate feedback from anyone who's already following you.
I never knew that it tells everybody.
Oh, yes. You can't subtly just make the change. It puts it out there.
Good to know.
Learned recently.
Yeah. Yeah, bad. Yeah.
Another recommendation to do is to apply for jobs and let your current employer know that you've passed. I think it's very important to reach out and send that email to whoever is designated in the company and let them know I'm ready to take on these new responsibilities and begin my journey as a BCBA here.
I think depending on the organization that you work for, there may be opportunities now that you've passed within your organization, or you may be in a situation where you're looking for a change. Mm-hmm. So either way, sort of planning for that can be important.
And one of the things we try to do here, and I know you've seen it already, when somebody passes the exam, sometimes they'll reach out to maybe HR, sometimes it'll be me, maybe it'll be right directly to Brett, but then we try to get a group of maybe 8 to 10 of us on a text thread with that person on there so that everybody gets to congratulate them. Mm-hmm. And then,
it's nice.
Yeah, it's a nice touch. And then oftentimes there's a subset of that group that'll want to meet with that person, typically within a day or two, kind of say, hey, congratulations, but here's the next step. Tell you a little bit about what a BCBA is going to be like in a school setting. If you haven't worked in home cases, this is what it'd look like. And here are your points of contact.
That's awesome. I'm so excited to go through that process.
Another really important recommendation would be if you are planning on doing any private work as a BCBA, you're going to want to obtain your personal professional liability insurance. This is going to protect you. And if you're contracting with individuals who are in districts, sometimes districts may be asking for that information. Even for working through insurance, that's going to be important. So getting that, if you're not just involved in an organization that provides that for you, making sure that you go out on your own and get that liability insurance.
Another recommendation is to start accruing your continuing education credits. So as BCBAs, we all need 32 every 2 years. Depending on the company you work for, oftentimes you might be able to get them directly through your company. So just by going to our leadership meetings, workshops we provide, those types of things. In addition, people should know, though, that you have to get a subset. Some need to be supervision. Some need to be ethics credits. The other thing I always try to recommend, it's one thing to just kind of fill up your 32 credits and be like, okay, I got it done. But I always try to make sure that at least some subset is on either something that's come up in the clinic, maybe it's a feeding issue that I don't have a lot of experience with, or it could be that there's a new type of treatment that's been developed. I'll try to take at least some of those CEs as well, not just to fill up the 32, but it's also a professional enrichment type thing.
Yeah, and there's lots of different places that you can get low cost and or free continuing education credits outside of conferences and things like that. But I would recommend that you budget to attend at least one conference a year, whether that's like a local or regional conference, because I think that the experience that you get listening to people talk live versus those virtual or podcast sees is really important. It's just very, very different. And the other thing that I always recommend too, sort of jumping on what you said, not necessarily just going to talks that are in your comfort zone, but learn something new. Stop into something that you're like, I have no experience with this, and I'm going to sit and listen and see, if this is going to apply to me at some point in any way. So branching out.
Yep, I definitely would love to go to more conferences. And just to segue off of that, another recommendation is to join some of those professional communities such as ABAI, APBA, NJABA, CalABA, depending on what state you're at. They should have those professional communities. So it's good to keep in touch with those people, maybe your master's program or your colleagues at work. I feel like I definitely have colleagues that I keep in touch with from my program that would help professional community that I don't know about, or any conferences that I should attend that are in a different state than I'm in.
Mm-hmm.
Yeah.
And it's great you're doing that, because I know sometimes I've talked with people, even pretty recent grads, and I said, do you still stay in touch with your faculty? And rather than just have a bunch of us from the same organization present, it's nice to have somebody maybe from your alma mater, right? And it's hard if you haven't maintained even minimal contact with that person. If it's 10 years later, you're like, hey, do you want to present? They might be like, who are you again? It's been a while. So it's great that you're doing that. And I would say too, and I know that, when people move from that RBT role to the BCBA role, yeah, they'll be making more money, but then it's oftentimes you've got student loans that are going to pay off, or it's like, I want to buy a car. So I really want to be in another professional organization. So it doesn't mean you have to do all of them, but definitely try to involve yourself with at least some. Just to, as you said, it's a very rewarding experience.
So sort of to expand on what I was talking about before in terms of branching out and going to different talks, if there are other areas of behavior analysis that you are not familiar with, really maybe honing in on one or two that you do want to, do more reading on, get continuing education on, maybe get some practical experience in, and whether that's OBM, feeding, severe behavior, maybe it's early intervention, trying to sort of hone in on expanding and getting appropriate mentorship in that area. So it's always good. You don't have to stay in sort of the area that you did your supervision experience in.
Yep.
Absolutely. I feel like when I first started in the field, I worked more in home sessions, and branching out, I was able to explore more in the school districts, and I think it's super rewarding branching out in different areas that you just aren't familiar with, and you had to learn, how IEPs work and how to interact with different district staff. And so it's super helpful to explore a specialization in the field. I feel like it's different and just gives a different lens.
Yeah.
Yeah, and I've even seen some people, when I've asked them, do you want to take this home case, and it's a 18-year-old male, and they're kind of like, I've never worked with that age group, and hell no. I don't want to do that. I guess if you're with a halfway decent organization, theoretically, they should be supporting you if you are working with again, maybe you're used to working with kids under 8. If you do work with somebody who's 18, theoretically, there should be support for you. And you're not just kind of thrown into that type of case. You've primarily worked with just autism. And again, there's this hesitancy, I think, to work with maybe the behavior disorder, conduct disorder type kids. And I get that, right? If you don't have any support, that's not a lot of fun. But if you're placed in a maybe a school setting where you've got other people who've worked with that group, that's a great way. It's kind of an immersion experience, right? And I'd really encourage people to try to do that. Really recommend getting your 8-hour supervision training fairly quickly. Again, I've had some people who, as soon as they're eligible to take that, they're jumping into it and they want to get it under their belt and out of the way. I've had others who are kind of like, well, I don't feel like I'm ready to supervise. And I guess that's okay too. But given how quickly our field grows, oftentimes one of the things we're looking for is that BCBA is eligible to provide supervision to RBTs and that type of thing. So it's recommended to, try to get that out of the way. It's, it's 8 hours. It's not that bad,
Yeah. And there's
Been
different
through it.
resources for that.
Yeah.
And I would agree, right? You might, obviously, you can't supervise someone who is trying to accrue their supervision hours for the exam until you've been a BCBA for a year. However, there are so many other sort of supervision like realities, right? Like you're supervising the RBTs, the staff in a classroom. And so you're going to learn some of those vital skills by taking that training and then being able to implement with the people that you're supervising even at that level. So even though it's not formal BACB supervision, it's still important.
Yeah, my program emphasizes how important it is to finish your 8-hour supervision as soon as possible.
Oh, that's good to hear.
Yeah.
One thing to do, depending on what each state requirements are, each state may have its separate state licensure, so it's definitely important to apply for that as soon as possible once you pass the BCBA exam.
We would recommend knowing what is going on in your state and then acting accordingly.
Yeah, and given that typically licensure involves some kind of a bill that's been approved by the state legislature, signed by the governor, so it's a law. And you don't want to be caught practicing without a license. That's like the last thing you want to be caught with. So do make sure and get familiar with your local state regulations on that. Again, it takes a little bit of time, a little extra money, but something we all have to do.
Next recommendation is don't forget your past. So this would be in terms of remaining connected with your faculty, your past supervisors, even students who are in the program at the same time as you. These are still your colleagues, right? And at some point, if we're all in this field of behavior analysis, this field is very small. As much as we're growing, it's still very small. But there's always going to be times where you might just need to pick up the phone or send an email or send a text and reach out to one of those people about something that's going on with you in your professional life, like your personal professional life. There might also be a time where maybe you've got a really challenging case and you don't have good mentorship in the organization that you're working in, but, keeping HIPAA in mind, being able to have a conversation about getting recommendations. It might be as simple as reaching out to someone that you know who works in feeding and say, I've got a student who's really challenging right now. Do you have recommendations on where I can send this family to? So using them as resources for both the individuals that you're working with, but also for yourself.
Absolutely. And I also think keeping in touch with your colleagues, I think that they also are reading updated literature that you may not have read yet, and it's important to be able to have somebody to reach out to be like, hey, do you know anything on this, or have you seen this behavior, or is there anything that I could read or any resource that you can help me out with, which I think it's having like more sets of eyes out there to help you with any of your clients and their behaviors, and I don't know.
Yeah.
And I would just say, keep in touch with your faculty and everything. I just posted something on Facebook a couple days ago. We were at the ABA-I conference just a few days ago, and I got a little sticker on my badge that said 45-year member, which I still think their math is wrong, but it's like, what the hell? But anyway, I posted it on Facebook, and I said something like, just so everybody knows, I was only 10 when I attended my first conference. And got a few comments and everything, but my undergrad advisor actually commented, and he said, but you were very mature 10. So clearly I still stay in touch with him. So if you ever watch these, Larry Morse in Florida, thanks for your mentorship and hanging in there with me.
That's awesome.
Try to keep up to date with the literature as best you can. And again, a few of us were just at our international conference. That's obviously a great way to stay in touch with everything. It can get expensive, right, if you got to fly across country or, in hotel rooms and things like that, which is why, again, you can often go, as you'd mentioned, go to state conferences. They tend to be cheaper, travel's a little bit less. You get some really amazing speakers. We just had, 2 great keynotes at New Jersey ABA. John Barrero and Bridget Taylor. And we're honored to have them. I still subscribe to both JABA and JAB, so I occasionally still read my Rad and Pigeon studies. I still think that's important. That's kind of my training. And another kind of little behavior hack that I always recommend, there's a website that's called ResearchGate, and it's free to sign up. And what a lot of people will do is they'll post their publications, because if you're not affiliated with a university like you are, and like
Right.
you are,
Then you lose access.
yeah, then you lose access, and then you got to, they got those paywalls up, and it's crazy. They want you to pay $30-$40 for one article. Nobody's going to do that, but ResearchGate is a great option for people too.
And even if somebody's not uploaded their article and they might just have it listed there, if you reach out to them,
They'll provide it.
they'll provide it. Yeah, so I've had students do that in the past, and I don't know that I've ever had anyone not responded to. So I think that that's really great. So for all our fellow behavior analysts who are sharing their research that way, thank you.
I feel very lucky because I have access to all the articles right now
Yeah.
through my university, and I'm dreading the day that I lose it all and I have to subscribe. And
Yeah, but and some university libraries don't have access to all of the journals. So my university didn't have access to Journal of Organizational Behavior Management, and that was the area that they were looking at. My student was looking at, and so that was great that they were willing to show that. So
yeah, that is so nice. I think also just to keep up with the literature as well, another good way to do it is to listen to the podcasts.
Yeah.
I think they're very effective in terms of just managing your time if you're on a drive somewhere or a long drive or going to work, to just like set on a podcast that will help teach you something, and without you having to really go out of your way to like research it right away and like search it. So for my next recommendation is to just think long term. So it's important to look at where do you want to be in 5 years and 10 years, and see if you want to maybe open up your own practice one day, if you want to have a leadership role, or if you want to work in schools, and just figure out what setting you really want to be in. Do you want to pursue further education, such as getting your doctorate? I feel like I'm kind of in that boat right now where I'm going to be graduating soon from my master's program. So I am wondering long term, like, will I go for a doctorate? Will I continue in this direction?
Yeah, big decisions. Yeah,
and they can change. So it's
Yeah.
okay if they change.
yeah.
Please like, share, and subscribe to disseminate the science of behavior analysis.